this morning. My name is Brandy Bauer. As Christy said, I'm director of the Center for Benefits Access at the National Council on Aging. We're very excited that you could join us today, and we really want this to be interactive. So feel free to interrupt myself and Emily at any point if you have questions or want some clarification on things. Just to get us started here, a little bit about the National Council on Aging. So the National Council on Aging has been around for a little over 70 years. We're a nonprofit service and advocacy organization headquartered in the Washington, D.C. metro area. And we have a vision of a just and caring society in which each of us, as we age, lives with dignity, purpose, and security. NCOA believes that everyone has the right to age well, but we are also very aware that there have been systemic inequities that make it impossible for all Americans to access the resources they need. That's why we really have a mission of improving the lives of millions of older adults with a special focus on those who are struggling. And we've made a goal to impact the health and economic security of 40 million older adults in the next decade, but with a particular focus on those who have been subject to those inequities. So including women, people of color, LGBTQ individuals, low-income households, and those who are isolated by geography and living in rural areas. NCOA focuses our work in two major areas. Our healthy living area works around issues related to prevention of chronic diseases, physical health and improvements in that, including preventing falls. Behavioral health, the mental health of older adults is a key issue that we're working on. And aging mastery, we have an aging mastery program that we have implemented in communities that really helps guide people to age well along a lot of both health and economic security parameters. We also work a lot in the financial security realm, specifically around benefits enrollment, which we're going to be talking about today. Since 2008, NCOA has had the grant from the U.S. Administration for Community Living to serve as the MIPA Resource Center. And for those of you who are not familiar with MIPA, it stands for Medicare Improvements for Patients and Providers Act. It's a piece of legislation that gives money to state aging and disability agencies to help low-income people with Medicare access subsidies and other programs that can help them to pay their bills. So we have been the Technical Assistance Center for states since 2008, since MIPA came out. And we really aim to improve access and enrollment into all of the programs that can help people stay financially secure and living at home and aging independently in their communities. And we're going to talk a lot more about some of those programs in a few moments. We also help around money management skills, job training. We're a national sponsor of the Senior Community Service Employment Program, or CSEP. And then we do work around retirement planning. So those are our two major areas of work. And then underlying that is a lot of policy and advocacy that we try to do at the national level to improve programs that help older adults to age well. So a little bit about what I'm going to talk about today with Emily. We're going to start by talking about this tool, Benefits Checkup. Some of you may be familiar with it. Some of you it may be a very first introduction. So we're going to assume that you don't know about it, and we're going to start from the very beginning. I'm also going to compare it to a tool that you have here in Michigan called MyBridges, and kind of explain what the differences are between them and how you can use them together. Emily is going to take it over and do a couple of demonstrations. She's going to show you how to use Benefits Checkup to do a very quick search for resources. So if you're just looking for food assistance programs, how would you use it for that? And then she's going to walk through the entire comprehensive screening, because the comprehensive screening helps people to look at their eligibility for a wide range of programs that they may be qualified for. And then after we do the demo, we're going to talk a little bit through some case scenarios. So, because I always find it helpful to sort of imagine somebody coming into your office or calling you on the phone, and they have a need, but your job as the social worker, as the case manager, is to sort of read between the lines and figure out, are there other programs that they're missing out on? And how might you begin to approach that? So we'll go through some of those case scenarios. And then I'm going to point out some other resources, including a new tool that we're going to be rolling out in Michigan later this year, specifically related to people who are dually eligible for Medicaid and Medicare. So you'll hear from us there in the end. And like I said before, this is meant to be interactive. Please feel free to enter your questions into the chat, and I'll ask Emily or Christy to interrupt me if there's anything that I need to throughout this presentation. So first, I would actually like to start with you and get a sense of my audience. And I would love to know, what are the most common benefits or programs that you may be helping seniors with? And if you don't help seniors, if you're working more with younger audiences, what are the programs that you're helping them with? Is it Medicaid? Is it some of the Medicare subsidies, like Medicare savings programs or extra help? Other kind of prescription programs, food assistance, utilities and housing, anything else? Feel free to just enter it into the chat. I like to get a sense of kind of where people are sitting within the benefits landscape. So I see some utilities, some food, some home repair. You don't have to be shy. Food, housing. Very good. Yeah, I saw some folks who are with, I believe, Meals on Wheels. I saw somebody in the audience. Medicare savings, Medicare coverage, utility assistance, home repairs, utilities. This is great. This is actually, I think, Medicaid waiver, PACE program, Medicare, Medicaid, LAS MSP, phone internet, Medicaid, Medicare. This is terrific. I think we have a wide range of people. And so I think you're going to find some of our, especially the case studies, quite helpful, because if you work more on the housing and food side, you may learn a little bit about sort of how to help people with Medicare. And if you work more on the Medicare, Medicaid side, you may be able to find more information about some of these other programs that can supplement people. So thank you for entering that into the chat. So we're going to be talking about a tool called Benefits Checkup. But before we get into that, I want to provide just a little bit of background. Benefits Checkup is a free online resource that was created by the National Council on Aging way back in 2001. It actually was originally on floppy disk format, if you remember those, and then later transferred over to the internet. But it was created during a time in which, the internet was sort of in its infancy. And in order to find out if you were potentially eligible for programs, you had to do a lot of research. You had to call phone numbers, you had to, fill out forms, go to a variety of places to be able to find information. And so we at NCOA thought, we could probably consolidate this information. We could probably design something that would help people to find all of the programs that they may be eligible for in one place, and then to guide them for what to do once they find out about those programs. So that's really the origin of Benefits Checkup. Last year, we launched the tool in Spanish. So now it is available in 2 languages. And Emily will later sort of toggle between the 2 to show you how that works. We're very fortunate. Lots of people use the tool. While it is certainly designed for older adults themselves, we know that case managers, community counselors like yourself use it on behalf of clients. Caregivers can use it. It's very much open for anybody who is working with the older adult population and wants to find out whether these programs are applicable to those clients. Now, I know, being in Michigan, many of you who do these programs are probably using the My Bridges tool, which is your state tool. And I want to kind of get us on the same page to differentiate between My Bridges and Benefits Checkup, so you understand the differences. So with the My Bridges, It does require site registration. So in order to be able to use that online tool, you have to sign up, have a login. And then once you have that login, you can search for resources and you can actually apply for programs. Benefits Checkup is completely open. There is no site registration or login information required. All of the screening is done anonymously. And while we collect aggregate data on the back end, so we know, out of 10,000 people, 8,000 looked at SNAP. We don't have any information that ties an individual to the screening, and we don't retain any of that personally identifiable information. MyBridges obviously is a portal for Michiganders of all ages, and it includes programs across the life spectrum. Whereas the Benefits Checkup was really designed with a focus on programs benefiting older adults. And by older adults, we kind of put 55 and older, although it is somewhat flexible. What I mean by that is that, obviously programs like Medicaid, programs like SNAP are available for populations across age groups. But what we do in Benefits Checkup is we look at that through the lens of eligibility specifically for an older adult household or a household with a person with disabilities. So taking, for example, SNAP, which I believe you guys call food assistance in Michigan, or food stamps. If you are over the age, if you have a member of your household that is 60 years or older, or a member of your household that has a disability, the eligibility rules for SNAP are different than in a household without one of those persons. In a household without an elderly person or a disabled person, it looks specifically at gross income, whereas in a household with a person who's 60 and older or with a disability, they're looking at deductions and then net income. And Benefits Checkup is designed specifically to account for those differences for the older adult population. So Emily will, in her comprehensive screening that she demonstrates, kind of talk through some of what's going on behind the screens. But basically, we wanted to make this as easy as possible for an older adult to really understand what they qualify for based on their unique circumstances and the unique eligibility requirements within a specific program. MyBridges obviously focuses on the programs that are available to people in Michigan. Benefits Checkup is nationwide, so while it is searchable at the zip code level and provides information on programs at the zip code level, whether that's coming down from the federal government, available across the state, or even some local programs. It also has programs from across the country. And that might be useful if, for example, you're getting a call from somebody who needs help, but then they're also mentioning, I have an elderly mother who lives in Illinois. Do you know if she's eligible for anything? With Benefits Checkup, you could also just use her zip code and find out that information, even though she's not in Michigan. MyBridges is available in English, Spanish, and Arabic. And then, as I said, Benefits Checkup is available in English and Spanish. However, we do have applications for a lot of the programs available in many languages. So for example, California has a very diverse population. LA County, their TANF application may have 10 languages. And in that case, all of those applications in different languages would be available in Benefits Checkup. The major difference is that MyBridges is really focused on application submission and case management. So helping somebody to take that step to apply for the benefit, to upload their documentation required, to track their progress in receiving that benefit, and then if after they receive that benefit, to track their need for renewing or recertifying for that benefit. So it is really on the very end goal of enrollment and keeping somebody enrolled in a program. Benefits Checkup is not an enrollment tool. It is focused solely on eligibility screening. So we want to help people get the information needed to take that next step, to go over to MyBridges. So our focus is, let's tell people to the best of our knowledge, based on all of the program application requirements, whether they're eligible, and then let's send them to the right place to get help or to file that application. So again, it's not an application tool with one exception, and that is the Part D Extra Help Program, otherwise known as LIS, or the Low Income Subsidy, which is a federal program administered by Social Security and Medicare. That is the only tool on our site where you can directly submit an application for that program because it is at the federal level. Everything else you need to apply elsewhere. So talking a little bit about the types of programs that are in benefits checkup, and this is not meant to be exclusive. I ran out of room on this slide, so this is just meant to give you a little bit of sense of the breadth. You know, in healthcare, we have all the different types of Medicaid, whether that's spend down, you know, regular Medicaid, expansion Medicaid, home and community-based services. We also have information about the state children's health insurance program because we recognize a lot of older adults are raising grandchildren, and you know, in those multi-generational households, there may be individuals that they also need insurance. We also have information about kind of donated dental care, vision care, chore services, sort of some of the help at home that people require. Prescriptions, like I said, we have the Part D Extra Help application, also a lot of information about these patient assistance programs, which are offered through the drug manufacturers, state pharmaceutical assistance programs, and then the prescription discount cards that you often see advertised on TV. We have a number of housing and utility benefits, including the low income home energy assistance program. I think that's called something like home heating credit in Michigan. Weatherization and home repair, some information on HUD housing and vouchers, and then emergency broadband, which now is the Affordable Connectivity Program, and as well as the Lifeline, the phone service. We have some income assistance programs like SSI and general cash assistance that are available through states, as well as pensions. Tax relief is usually within the realm of property tax rebates and discounts available to older homeowners, as well as tax related to federal and state income tax exemptions and relief. For veterans benefits, it's a little bit harder for us to screen for veterans benefits. So we don't necessarily have the in-depth eligibility on these, but we do have information about veterans benefits. And if somebody indicates that they have had military service, we do point them over to their local veteran service office in order to get more information about those programs. Food assistance runs the gamut from the federal food stamp program to some farmers markets, commodity foods, as well as home delivered and congregate meals, and links to the network of Feeding America food banks. And then we have a wide range of other programs that don't really neatly fit into any of these categories, things like the Senior Community Service Employment Program, different assistive technologies and respite care and care for people who are dealing with Alzheimer's, legal services, transportation. We even have discounted national passes for National Park Service. So they're just a wide range of programs, everything from the federal level all the way down to some local level programs. But I think the best thing to do is to turn it over now to my colleague, Emily, and she is going to do a demonstration of not only how you do a very quick search for information, but also how you do a comprehensive screening. And so I am going to stop sharing and allow her to share her benefits checkup screen.
All right, there we go. Okay, is everyone seeing the website?
Yes.
Perfect, thanks, Brandy. And I do want to reiterate what Brandy said earlier. Please interrupt if you have questions. I definitely want to be interactive. So if there's anything that we're going through too fast or too slow, or you have more questions, let us know. So this is the home screen for benefits checkup. And you'll see here, there's a couple different options, and I want to talk through them really quickly before we go on. First of all, one thing that Brandy spoke about was the Spanish version of the site. And so we have here kind of the toggle back and forth, and I'll go over to the Spanish quickly. And so you'll see all of the information is duplicated. You can have the same experience with a Spanish speaking client or with yourself. And then you can toggle back to English as well. One other thing I want to mention, we often have topics that become particularly relevant at certain times. And so right now, we're featuring the LINET program. When there are certain kind of natural disasters, those sorts of things, we might have a specific FEMA program linked here, but we'll have whatever we're hearing from the community people are looking for and most interested in. So I'm going to start with what we call kind of our quick research source. And this is going through without eligibility information. So I'm just going to go to resources near me. And it is a little slower since I'm sharing, so my apologies. But let's enter in a zip code. One thing you can see here is if you don't even want to go to the local zip codes, you can see down below our most popular programs. And so if you wanted to, you could just go directly to them. As Brandy mentioned, you could apply directly for the low income subsidy right here, or just kind of finding these are the most popular programs that we find people click on. But let's go in and we'll look for some locally relevant programs. So I put in my zip code, and then I'm going to get a list of programs, and I've gotten 104. So that's a little overwhelming. And they are linked in terms of what are the most popular ones, but I'm going to filter here because I'm looking with someone who's specifically interested in food and nutrition. And by doing that, I go from 104 programs to 7 programs. And you can click as many different topics as you want here. You could add anything. And you can also determine, right now I have it, and it's always pre-selected to show the benefits that do require a limited income and have some sort of an income cap. You can take that off if you're working with someone who you think would not meet those, but typically I would just always leave that on. So by doing that, now I've gotten specifically to the food and nutrition programs that are for my zip code that I just put in. And so this, again, hasn't done any eligibility screening, but it just connects you directly to the program that would be relevant. So if you know someone, for instance, is interested in and probably eligible for food stamps or the food assistance program, you can go directly there. And here you'll get the information you need, including the application forms, the program website, stores where people can use their cards, phone numbers and contact information. And then for each of these programs, we'll have frequently asked questions. So if you have, for instance, someone with maybe some citizenship questions, you could find that here. You can also get a list of all the documents you'll need to apply and kind of an overview of what those are. And then information about whether you can buy groceries online. That's a big question we get often. And so that's specific to Michigan here. And then also information about where an individual could get help applying. And in this case, we've got the Elder Law of Michigan, BEC, linked here. Let's see, I'm going to go back now. And I'll filter one more time. Let's add in housing and utilities. So now I've gone from 7 to 21 results. And again, none of this is screened at this point. It's just showing you all of the programs available. So you'll see the reverse mortgage counseling, FAIR plan, flood insurance, really any program that relates to housing in the state of Michigan or in that zip code specifically. So you'll see that. And again, you can filter by anything you'd like. Adding transportation adds a couple, employment adds a couple. You can kind of go through and decide what you'd like to do. I'm going to clear all. Any questions about the quick screen? It's not a quick screen, sorry, the quick search. Okay, let's go back and we'll do the full screening now. I'm going to go back over here. So if you have someone who doesn't know exactly what they want or they're interested in really getting that screening result, we'd want to go here. And you can also do this when we're on the home page. You could also start here. It'll take you to the same place. So let's do that, 48033. All right. And so we'll start with a very quick overview here. And they're really asking just some basic questions to get at a very broad understanding of the individual. Now here you would have the option for yourself, for a client, for a family member. I'm going to use test case since I'm just playing with the site so that we won't save this information because we do collect all of this data at an aggregate level to see what people need, what's happening across the country, and who's using the service. And for this one, I'll go ahead and set female. And I'll just go with August. Again, we're not doing myself a little bit older. This is very general. And then again, here's a question about income. And this might be one where you might have a client who isn't entirely sure. I think you can do a best guess here. And if you have someone who you want to really make sure doesn't screen out of anything and you get to see all the options, you can always go with a lower number. I would always go lower instead of higher to be sure that you're showing someone all their options. So I'm going to go with that. And then I will say single here, but of course you have different options. As Brandy said, we do screen and share some veterans programs. So that's a question here. I will not say that for now. And then there's a question about race and ethnicity. And as Brandy said, we have at NCOA specific target populations we're hoping to serve. But this question is entirely optional and someone can choose to answer it or not. It doesn't it doesn't impact any of the results they'll get. So I'm going to skip that one. And then here, it's asking me to select what I'm interested in. You can select all if you have someone who really wants to see everything available to them. You could also screen for particular programs. Say you have someone who's really interested in medication, healthcare, and tax relief. For our purposes, I'm going to select all. And then we hit continue. And so this is, we sometimes call it the pre-screen. It's going to give us a very broad overview of what we might be eligible for. And this is a little pop-up. You can sign up here. I'm going to just close it, but that would give someone information and resources through email. All right, so the initial results show there are 84 benefits programs that match what we've told them so far. And again, this is very high level. So we'd want to do the comprehensive screening to find out more, and we'll do that in a second. But if you just wanted to see some of the things you're probably eligible for, they're here and they're broken down by category. So medication benefits, healthcare, there's quite a bit here. And you can always continue to go on to the program. But you'll see here, since we selected all, we're getting everything. So there's quite a bit here. So let's keep going to narrow it down some more. All right, now we have another option here to just reaffirm that that's what we want. I can take some off if I want or add them back in. That's just to check to make sure you're getting what you really want. All right, now we're in the comprehensive screening. And it gives me a little idea over here of what I've already answered, what I said I was interested in. The next question is about who you're already receiving benefits from. And this is important, especially when we think about income and then how income's calculated and some of the benefits that you want to make sure that you're sharing with someone and that they're not going to lose out on anything. It also gives us an idea, for instance, if you're already in Medicare, some of the things that you'd be available for, that would be available for you as well. So I'm going to say that I'm already on Medicare and I do also receive food assistance. And then this is an optional question as well. We're just trying to kind of get a sense of where people are coming to us from. But again, doesn't impact any results and you do not have to complete that. Continue. Okay, so now there's some questions about health. And the first one starts with a question about military service and specifically thinking about military service and Medicare. I'm going to say no because I indicated that I was not a veteran. I am going to say I take some medications. And so this one right here will take you through, if you have an individual who's on a specific medication, you can find out more about the prescription assistance programs that might be available for that medication. And what you'll do is if you hit select, it'll start telling you all of the medications. You could also start to type in the name of a medication. Let's see. Let's say that one. Just picked at random. And you can add as many as you want to your list. And so that person will be able to see then if there are discount programs available for that specific medication. That may not be as relevant for folks who are already on Medicare, but if you have someone who's younger or not on Medicare yet, this would be a great option for them. Here's a question about eye exams, and this would help direct someone to some of the programs available there. And then there's a question here about disability, and we do outline that a little bit. Some programs will have specific criteria or documentation, and different programs have different definitions of disability. I'm going to say yes. There's also a question of whether someone is legally blind. And again, all of these questions are to share and make sure you're getting all the benefits programs you would be eligible for. I'm going to say I'm not dependent, but that's a question about caregiving and physical state. Now, here's some more information. So I can specifically select some of the programs if I want specific information about additional programs. So I'm going to say I'm interested in caregiver respite programs, dental and health, and let's see, I'll say Social Security. As Brandy said, we also connect to the state, to the CHIP programs, to the Children's Health Insurance programs. And so if you have a child in your life or are raising someone, you could enter this here. I'm going to say no for our purposes. One thing I want to point out too, so as I'm going through this, some of the questions could be a little confusing. For instance, let's do type of housing. I'm going to say a rental. Now there's a question here about household, and this can be, this can sometimes be confusing for people. I find it a little hard to think about, am I including myself, am I not? And in this case, you're including yourself and your spouse in each total. So for my case, I'm going to say I live alone. I only have one, and I have one. So that just means it myself. But if I'm doing this and I get a little confused, I can always go over here and we have a live chat available. And I could ask, for instance, I have a question about this household category. If I just live alone, what should I enter there? And I can send that message through the live chat here and automatically get a response back. And one thing that's, I think, I don't know, unique, but that I really appreciate about our site is that's a real person. So it's actually Anaya on our team answers all those questions. And so you're not only getting the information you need, but you're connecting to a real individual who can then answer your questions about other things, help you out with any questions you have, and kind of walk you through any of that. So I would really urge you to make use of this. It is only from 9 to 5, Monday through Friday. Just because, again, it's a real person. So she has other things in her life, but it's really useful here. And we get some really good data as well about where people are having problems, where people have questions, and then that helps us improve benefits checkup. Brandy will talk about this more too, but there's also a phone line that you can call, toll-free helpline. And again, that connects you to a team of folks who work with Anaya as well and are connected with her. And they can walk you through any questions you have. So either way. Okay, so I figured that out. I am 60 years plus, so I'm going to say yes. And I did also say I had a disability. This auto-filled from before, but you can always change it if you need to. I said I was a renter, so I'm going to say I don't pay property taxes. And I am going to say that I do pay my own gas or electric bill. And the reason that it's asking me this is just so that they can share any utility programs. Can we get a copy emailed? Yes. Sorry, there was a question in the chat about getting a copy of the sheet with all the service categories listed. And absolutely, I think we can share that. So let's continue. And please do feel free to share any other questions. And you'll see here's the help numbers up here still in the chats here too. Okay, so now these questions are going to be asking me about some money. And the reason we ask this is, again, because of the income qualifications in some of these programs. And this is for the whole household. And if you're working with a client, this will also say at the top here, just reminder, answer your questions as your client. In my case, it says test case, because that's what I've said I am. So these are just estimates. It doesn't have to be perfect. And so if you are with someone and they're stressing about knowing the exact numbers, really, really, you have a lot of options here. So let's say my rent is $750. I don't have a mortgage. I'm going to say I pay $80 in electric. Say my house doesn't have gas and I pay $30 in water. Telephone, I'm going to say $75. Other utilities, and this will tell you, you could put in, sewer, garbage, propane, anything there. And then dependent care would be if you're paying for childcare, elder care, so that someone can go to work. And in my case, I didn't say I had a dependent, so I'm not going to select that. And then there's a question here too about medical expenses not covered by health insurance. And so that could be prescription drugs, insurance premiums, deductibles, co-payments, home health, nursing home expenses. There's a lot you could have there. And again, this is all an estimate, so you can really be flexible here. It's just trying to give someone a sense of the programs they would qualify for. And I would always go lower rather than higher when you're estimating, so that we don't miss a program for one of our clients. For this one, I'm going to say that we spend $100 a month because we have Medicare. Okay, then going down here, this is also asking about where income might come from. And you'll just want to enter the gross amount. And this is monthly as well. Above was monthly too. So we're thinking about this all in terms of a month. And again, just an estimate. I think we're putting this in here too. So we want to make sure if someone doesn't know their exact pension, those sorts of things, they can go from there. So I said I was single. I'm going to say my pension is $800 a month. If I had a spouse or partner, I would enter their pension here too. So say I had a spouse who had a pension of $950. I enter theirs there, and then they're totaled up here. I did say I was single, so I'm going to take that out. And then I'm also going to say I get Social Security. Let's say I get $1,000 from that. And same here, you put yourself here or your client here, and then their spouse or partner who contributes to the household would be the second one here. And this is another one where it can be a little confusing. Always here for you. Chat, ask. We're happy to help. So I'm going to say I get those two. And I think that's all we'll say we get, but you could enter more here. And part of the reason we break these down by categories is so that if there is a type of income that is not counted against a benefit, we'll be able to know that. Oh yeah, life insurance. Good question. Thank you, Brandy. All right, I'm going to minimize this so I can go to the next one.
Oh, actually, Emily, could you go back? I think there was, scroll down again. I think that question about life insurance. Yeah, this is
sorry.
The assets. This was what I was thinking.
Yes. Yeah. My apologies. I didn't scroll down far enough. So the next question is about assets. And we're asking this again because some of the benefits programs either count or don't count assets. And that's part of why we want to have this in this way, broken down so that we know. And again, just estimate. I'm going to say that I have a retirement account with $25,000. And I said I'm renting, but if I wasn't renting, I could put the value of my home investments. I'm going to put a car and say it's worth $900. No, let's make it 15. Okay. You can have a second car. And then again, there's life insurance here. You could do the cash value, and that would be yourself and then your partner or spouse to get you to the total. And cash value versus face value would be the two different things there. And your life insurance policy would have that information. If somebody doesn't have that information on them, they know they have life insurance, but they might not know the values here. You're fine to skip that. It's just to give us a more accurate sense of the screening. And as we talk about this too, like a burial account, say we don't know the difference, or we don't know which we have, or other assets, it's totally fine to just keep going. The point is to get through it. The better information you get, the better screening you will get. So you want to be as accurate as possible. But again, our goal is to give people a list of the screenings or the programs they're eligible for. And then you would still have to verify these amounts when you apply for the program. So if it's not perfect, that's okay. You're not submitting an application for benefits right now. Any questions so far? All right, I'm going to continue. I'm going to say it's moving a little slow since I'm sharing my screen. Just give it 1 second. Okay, so now I have the results. Based on the information I entered, I've got 40 different programs that match what we've told them. And they're broken down just like they were in the pre-screen in different categories. And you can click on them and see which you have. In this case, for instance, you'll see the Michigan Prescription Drug Program. Because I entered my medications, I'm seeing a specific program for my medication. And this is a patient assistance program, which would give a discount or free medication for that, or sorry, free medication, yeah, for the prescription I said I have. There's also a program here. This is another one that comes up because of the prescriptions I entered. One of the drugs I said I was using was for rheumatology, and this is the organization that owns that. So again, they're doing discount programs. Pfizer as well. So that gives you a sense of all of these. And you can go through and apply for those. Let's click on one. Let's say we wanted to do the Pfizer. So this gives the person the information to go through if you wanted to. If you had someone who wanted to go through, you could go do the program website and click through. Just like with our SNAP that we looked at earlier, you'll see the different information about this program. Because this is a drug, we have a specific piece here about Medicare that lets you know if you could still take part in it, what you need to apply, and then also the information about who could help you apply. And we've sent folks here again to Elder Law of Michigan. Let's go back. It's thinking. Okay. So we've got the personalized report, and we've decided we want to print this out for our client. So let's go through. It'll go to view and print your benefit report. And then I can decide here, this is going to show me all the programs it said that my client was eligible for. And I may decide that some of these programs are not going to be helpful, or they're not going to need the information on that. Say, I've got all of these food and nutrition benefits, but I really think what they need more than anything is the senior farmers market program, for instance. And I can do the same here. I can say housing wise, weatherization would be helpful, the broadband benefit because of utilities, and HUD. Employment, I might decide that's not relevant. Transportation, maybe Amtrak doesn't seem relevant for where I live. Or education, I'm not going to add any at this point. America the Beautiful, this is the National Parks Pass that Brandy was talking about. I can kind of decide. For instance, here you'll see some Alzheimer's resources were shared. And for my purposes, that's not going to be helpful. So I've selected the ones I'm most interested in. Say I'm interested in eye care and dental. And here I'm just really interested in the Medicare. You can also select all if you want to see them all, or clear all. So now I've decided what I want. Those are the ones that I want to see more information on. I can also customize it even more. So if I want to print out for someone the full program information, that would be just like what we saw before, with all of the, FAQs, all of the contact information, everything you would need to have to apply. Or I can decide, I think I just want the program descriptions and contact information, because I'm just giving this to someone so that they can go to the agencies, or I can help them go to the agencies and apply. You can also choose program descriptions only. if you just want a list of programs, or the cover page and table of contents, which would basically just be the top level. For my purposes, I'm going to do program descriptions and contact information. You can also print each program on a new page if you want someone to have page by page. For my purposes here, I'm going to leave that unchecked because I'm fine with it being one continuous report. Here it comes. And this can also be helpful if you have someone who has multiple needs at the same time, and you really want to focus on specific things with them first, because they can always come back and apply for other programs later. Unfortunately, it's been very slow thanks to the screen sharing, but typically it would pop right up. Let's see. Come on, friend. Try that one more time. There it goes. Okay. So now I'm seeing the report. Can you see this report, Brandy?
Yes.
Okay, good. Couldn't remember if I shared all my screens or not. So this is the report you'll get. And this is something you can email to someone. You can download it as a PDF. You could email it. You can print it. And you'll see here, it gives somebody an overview. First is the table of contents. So it's just sharing, these are the programs that you selected, and you can click through them that way. Or you can go to the top and go back down. And so this is what someone would get if you printed and selected only the program descriptions and the contact information. So this just gives them an idea. What is the program? How do I apply? And then you've got your contact information here, your phone number, website, address. Oops, went a little too far there. Same here for housing and utilities, weatherization, and this gives you the specific agency if you were looking for that help that you want to go to. Again, I didn't print out, and you could print out all of the FAQs and the full program description that you would see on that webpage, but it gets pretty long. So this is the one I tend to like. The broadband, this is the money that qualifying households get right now towards broadband service. So this is a really nice one, I think, to share for folks. And again, you've got here, this one is just the website. And it's got that right here. So you can do that because they don't have a physical office for that. But you'll see each of these, the housing, here we go. There's some physical locations and there's a number in Michigan. So it's giving you the full list, which is long. Transportation, directing you back to the area agency on aging that's nearest to your zip code. And all of this will be specific to that person's zip code. And then some information about the eye care program, donated dental services. You can go through the state agency to get information about that. And there's the national office for that as well, which is where you would call. Prescription drugs. So this just gives you an idea of what the report could look like. And this could be something you could print out for your client, email to them, save for them so they'd have this information and they could move forward with it if they'd like to. Any questions about the screening?
One quick question.
Yes.
How do you deal with a client who's in front of you? I know COVID-19 has probably made that almost nearly impossible, but if someone is sitting in your office and you're providing benefit counseling and they're right there with you and you go through that benefit checkup,
yeah,
how do you work with them to decide what they want to prioritize so that if they secure some priority benefit, it doesn't prevent them from getting something else that they may need?
Yeah, it's usually, I mean, usually they're going to hopefully come to you with a specific area of need, you know, oh, you know, it's my housing is really expensive and that sort of thing. I often would prioritize what you think they can get quickest. So for example, if there's a relatively quick turnaround in the food assistance program, or extra help is a pretty rapid turnaround, like 2 weeks, helping them to apply for that right away, or the program that may have the shortest application, or a multi-program application, because sometimes you can apply for Medicaid, food assistance, all at the same time, and really sort of focusing in on what can you get them quickly, what can you get them that sort of hopefully meets an immediate need, and then have a conversation like, I'm going to try to help you with this today, but can I follow up with you? Can I help you with these other things down the line? Is generally a way that we have approached it.
Thank you.
That's a great question. Other questions? Okay, let's see. I'm going to try to share the PowerPoint. Or Brandy, do you want to go back to the PowerPoint?
Yeah, let me do that. So let me, I can take over again. Okay. Can you see my PowerPoint, Emily?
Yeah.
Okay. Okay.
So having gone through that, I will share there's a new version of Benefits Checkup coming out this June. And it's going to be, this will be very relevant to what you've already seen. Very similar, not a lot of changes from the user perspective, but there are some important changes that we think is going to make it easier for people to use, and break down some of the barriers to access for folks. Because some of the things we found through our usability testing is at the site, not for professionals, but for individuals, especially individuals with low digital literacy, can be really troublesome, and people can get stuck at certain points. So some of the things that'll be coming in the new version is really quick access to the benefits assistance programs and more abilities to search and filter, so that people don't have to go through the full screening if they have specific needs. And if you're working with someone, say, who is really just interested in housing, you'll be able to get to those resources even quicker with less questions. And that's one of our goals, is to make kind of all of the barriers broken down so that it's easy as possible for users. You can also screen for a single program at the category level, or all programs. So you'll be able to really decide, if I just have someone who wants to screen for this one specific program, say the food assistance, they can go through and just do that screening pretty easily. Whereas now that would be difficult. Or if someone's just interested in healthcare programs, they can do that in a new way that'll be a little bit easier. Prescription assistance, for instance. And of course, you'll always be able to screen for all programs. You'll also see an estimated value of the benefits on the program page, which might help as well with what you were talking about, excuse me, with the question asked around prioritizing, because you'll get a sense then of what the estimated value, not in a perfect, not the exact down to the cents, but a sense for your client about the estimated value of the benefit to them. And that should help both with prioritizing and understanding what's realistic for them with that specific benefit. We'll also have the personalized report will be a little bit easier to go through, and I'll have really great next steps on how to apply and taking someone through at a more detailed level. So that report that we just went through will have even more details for an individual if they're trying to use that to go and apply and go for the next steps. The other thing we'll have that we don't have now, it might not be obvious, but we don't have the ability to have articles on the site. And so we'll be able to have articles specifically about different topics, say, the top 5 benefits in this state, things like that, so that we'll have more content that someone could read through and make it to programs faster and benefits faster. It'll also just be a little bit prettier. We're pretty excited. The design is quite nice. And we'll have that streamlined approach so that people can get to their benefits even faster.
Yeah, and I think, as Emily noted, it'll be quite useful for you as counselors, because I know a lot of you probably have some of the eligibility criteria almost memorized for some of these programs. So the ability for you to not have to do a whole comprehensive screening when you really just want to see, all right, I know they're have Medicaid and I know they have, extra help, but I really just want to see if they're eligible for the broadband benefit. You'll be able to just do that and do that screening alone and not have to answer questions about prescriptions or, housing when you're only focused on that. So we're hoping that it creates just an easier, quicker pathway for you to get that information to your clients.
Absolutely. Great point, Brandy.
Great. And so if nobody has direct questions for Emily yet, I thought what we do is just talk through a few counseling scenarios, because I think it's helpful for us to think about what this means when people are coming in front of you. I thought Anne's question earlier really set us up perfectly for this. And it's really just things as a counselor that you want to think about as you're dealing with a client in front of you or over the phone. Like I said, what is that person's immediate need? A lot of times they'll know what they want. Housing is too expensive. I need to figure out my housing. Sometimes they'll just be so in crisis on so many levels that there will not necessarily be a clear path forward. But to the extent that you can sort of help them identify, what do you need tomorrow? Versus, we know that you need income support sort of down the line. And to the extent that you're able to assist with whatever the application is for that immediate need or an appropriate referral, because sometimes it's not going to necessarily be a benefit or even something that you can help with. Obviously affordable housing is a huge issue across the country, and it's something we're hearing a lot from people who are chatting with us through benefits checkup or calling the helpline. You're not always going to be able to solve for that, but if to the extent that you can help free up income in other areas of their budget, that would then allow them a little more wiggle room to pay for housing, that's an approach. Obviously you want to, even if you're not doing the comprehensive screening, just get a sense of if they're getting help from other programs, because some of these programs have what is called categorical eligibility. So if you're already getting SSI or LIHEAP, that in many ways that proves that you're eligible for something else. Asking about other members of the household, always a good step, to find out if there are sort of hidden needs, whether it's a caregiving arrangement that somebody's, putting a lot of effort into, effort and money, raising grandchildren. Another thing is also military service. Sometimes if you ask folks, are you a veteran? They'll say no, because for a long time, veterans benefits and veterans programs were associated solely with people who had combat related experience. And so you get people who had 20 years in the service, but didn't consider themselves a veteran because they never served in a combat situation. So asking, do you or your spouse, does anybody have military service, gets at that veteran status, even if they don't sort of self-identify as a veteran. And that may open a door into some of those other programs. Sort of other questions that you can do to uncover areas of need. Do you have enough of your medications each month? Do you have problems getting your medications? Are you splitting your pills? Sympathy, rising food costs. We know that inflation is outpacing the cost of living adjustments in Social Security. Have you been able to keep up with your food costs? Are you having to make any sacrifices? Are you keeping your heat down low because you can't afford to appropriately heat your home because you're trying to use that money for food? I think always just approaching the situation with can I help you see if there's other ways we can free up some money for you? Rather than focusing on programs and benefits and eligibility, it's just we're going to help you free up your budget. We're going to help you sort of find some money. And then the ability, I'm not sure, depending on where you work and your sort of office situation, if you're able to follow up, if you're able to help somebody with one or two immediate programs, but then also follow up with them afterwards, to see that they got it, but then also be like, hey, now that you got this, can I help you with such and such an application? The extent that you're able to do that, I think that helps to build trust in a relationship. And often once somebody's found their way into one program and you have helped them with that, they're a little bit more welcoming of additional assistance when they see that, oh, you helped this work for me. So I wanted to just do a few little like scenarios that I made up and kind of have us think about what we might do if these individuals sort of stepped in your door, called you on the phone, and kind of approaching them from a couple different angles. So I tried to come up with some examples where what you help the person with may vary. So let's start with Sylvia from Grand Rapids. So Sylvia is 68 and she is coming to you because she received a letter from Social Security about needing to confirm that she's still eligible for the Part D low income subsidy or extra help program. So for those of you who may not realize this, even though this is a federal benefit and most people sort of auto recertify, there's usually a handful of folks across the country who either a change in income means that they get this letter, or there's also kind of a quality control measure within Social Security. So sometimes they will randomly select people to receive a, just a sort of check to make sure they're still eligible for the program. So she comes to you, she has this letter. And she tells you that she's her only income is a monthly Social Security benefit of $1,143. So you find out from talking to her, obviously she's enrolled in extra help. She's also enrolled in one of the Medicare savings programs known as SLIMB, which helps to pay her Part B premium each month. But she tells you she still has a lot of high medical costs because she's in a Part D drug plan that doesn't cover one of her 3 prescriptions. She's a cancer survivor. She has a lot of follow-up therapy and appointments, and she's still responsible for those 20% co-pays under Medicare, which aren't covered by SLIMB because SLIMB is only covering her premium and not some of those other costs. So what are some of the ways that you could help Sylvia? And I would certainly love for folks to type in ideas into the chat before I move to the next slide and give you some clues. Everybody's so quiet. All right, I will give you a throw it out here. Okay. So obviously she came to you with this letter and you want to, very first thing, help her respond to the letter. So there should be instructions on the letter from Social Security about anything that she needs to do to respond. That will probably require her just signing something and sending it back in. But obviously that is number one because we don't want her to lose her extra help. Now, if you are working as a Medicare counselor, which some of you are, you might want to work with Sylvia to look at the Medicare plan finder and see if there is another Part D drug plan that could better meet her needs and cover all of those 3 prescriptions. Because she's, as she said, one of them was not covered at all. Something unique is for people who receive the extra help benefit, they get a special enrollment period where they're able to change their drug plan once every quarter. Unlike other people who would have to wait until that general annual election period in the fall, Sylvia would fall under this special enrollment period. So if there is another drug plan that she could enroll in and save her money, it would be worth doing that. Now, some of you on this call don't work with Medicare. You're not Medicare counselors. In that case, you would want to make sure that you're referring her to the local MAP counselor. And MAP is the Medicare Medicaid Assistance Program or the State Health Insurance Assistance Program in Michigan, providing unbiased, objective assistance for people with Medicare to help them make decisions around their plans and their coverage. So that's some of her sort of Medicare issues right there. Obviously, you would also want to help see if there's prescription assistance programs. This is where you could use benefits checkup, specifically around prescription coverage. And if there isn't a Part D drug plan that covers all of her prescriptions, see if there's any drug manufacturer or other programs that would help to offset those costs, as well as any other kind of assistive programs that can help pay for some of her medical bills. But also, she may still have a number of copays that she's going to be responsible for. So this is where you might want to say, hey, I can help get your costs down in this area, but have you got food assistance? Because there's excess medical expense deduction to qualify for food assistance, where anything you spend in a month over $35 can be deducted from your income, which makes you more eligible for the benefit and eligible for a higher amount of the benefit. So that would be an area where you might want to explore with her. If she's not already participating in that program, you can leverage some of the expenses that she's experiencing under her medical care to get her into this food assistance program. So that's just a sort of example of how you might approach a person like Sylvia. Now I'm going to do another scenario. This is Robert, who's in Detroit. And we're going to say that Robert is 62. He is a recent widower who's raising his two grandsons who are 15 and 12. Robert receives Medicare due to disability, and he has an income of roughly $1,500 a month, which is split between his SSDI payment and a small pension that he receives. Robert is a homeowner, and his furnace is very old. His home has been hard to heat this winter, and he's worrying about the effect that this is going to have on one of his grandsons who has asthma. So he comes to you and he asks specifically about this home heating credit that he's heard about on television or something. So how might you help Robert? Well, obviously you want to screen him for the home heating credit. That's why he came into your office. See if he's eligible for that or other similar kind of heating, cooling assistance benefits. But you also might want to mention, he's a homeowner. Like, let's talk about your furnace. How old is your home? How old is your furnace? There's this other program called weatherization assistance, and it helps people to upgrade some of their utilities, like their air conditioner and their furnace, if they qualify. So let's see if you qualify for that as well. And that's an area where it's in benefits checkup. You could search specifically for that. Also, as a homeowner, are you taking advantage of any tax discounts or rebates? You probably qualify for something due to either age or disability. So let's make sure you're getting the maximum property tax relief that you're able to get. But this is also where you would pivot to talk about his grandsons. They're living with you. Do they have insurance? Help them to get S-chip, which is also in benefits checkup. Does he get any assistance with their care? Is he receiving anything, from a family member or others to help with the expenses? And does his grandson with asthma have access to the appropriate inhalers or other medication? Because even though, the patient assistance programs and benefits checkup, even though benefits checkup, we always say is kind of geared towards older adults, those programs are available to people of all ages. So you could certainly look and see if that medication is, or that asthma treatment is, available through some of these other programs for his grandson. And then just like with Sylvia, you'd want to talk about his participation or interest in anything else that he may be struggling with, getting the kids to eat healthy food. Do you have enough, money for groceries, that sort of thing. All right, now third scenario. This is Samira from Mount Clemens. This is something you'll often hear from is some adult child of aging parents who want to contact you because they're very concerned about their parents' well-being. So Samira is 45. She is worried about her aging parents who came to the US from Lebanon in the 1980s and are naturalized citizens. Samira's parents live in a house that they own, and her mother is struggling to care for her father who has dementia. Samira is calling you because her parents' food assistance benefits recently decreased, and the cost of her father's care is rising. So what are some of the ways that you could help Samira help her parents in this situation? Well, the first thing obviously is you want to try and see if you can get behind why was their food assistance decreased? There was a COVID legislation had put out a kind of temporary increase in food assistance benefits across the country. So for about 18 months there, people who received any sort of food stamps would have gotten kind of the maximum benefit. And then as the public health emergency is winding down, those benefit amounts are going back to what they were kind of pre-COVID. So that might be a reason behind it, but there also might be some other factors at play. Perhaps there was some sort of change in income that affected their eligibility or the amount that they're getting. And this is another area where you want to definitely look into that excess medical expense deduction. So if presumably Samira's father, who has dementia, is incurring a fair amount of medical costs, have they kind of written those up? Have they visited their SNAP case manager to report those and maybe get a redetermination of the benefit amount? That is something that you can do at any point. You don't have to wait for recertification. If somebody's had an experience, a change in income or significant medical expenses, they can approach the food assistance office and see about reconfiguring their benefit amount based on that. Are there other food assistance programs that they might be eligible for, whether that's like commodity supplemental food, perhaps congregate meals or home delivered meals, especially as Samira's mother is a caregiver. Always good to ask about her parents' health insurance. Do they have Medicare? Are they enrolled in, Medicare Advantage or a separate Part D plan? Encouraging them to get that counseling from a MAP counselor to make sure they're in the appropriate plan and not sort of spending excessively on that. Are they getting any help with costs? Do they qualify for the Medicare savings programs or extra help? And then, because we're talking about a caregiving situation, it might be nice to look into some of the programs and benefits checkup that are about respite care or adult daycare. Because if Samira's mother is bearing the burden of caring for her father with dementia, she may be very much burnt out. And perhaps they're open to this idea of having somebody either come into the house and help care one day a week, or someplace that they can take the father to assist with that care. So that's just some examples of how you might approach a counseling scenario where somebody comes in with what they think is a specific need, but that you can look across kind of the spectrum of programs available to them. And this is really where I think you would use benefits checkup, especially the short kind of find resources that Emily demonstrated early on, where you would plug in that zip code, and then you might look under healthcare and see what sort of respite care, adult daycare programs are available, and provide that information to Samira and her family. Any questions on any of that? Okay.
Just one quick question.
Yes.
Are there ways to get around having to do multiple applications for benefits? I know in Michigan we have My Soap and then we have My Bridges, but oftentimes people have to do it over and over again.
I know this is the $1 million question, and the unfortunate answer is not really. To the extent that you're able, like with My Bridges, or to be able to have a multi-program application. I'm not sure whether you have like food assistance, Medicaid together on a program. Unfortunately, one of the things we're actually researching at NCOA is a kind of whether there can be some sort of automated eligibility rules engine that would pre-populate other forms. I think we're years away from getting into that state. So the unfortunate thing is, I think at this point, you're going to have to import that information on multiple applications. Yeah. Unless there's a program that like where you simply prove enrollment in another program makes you eligible, like sometimes with SSI or like Lifeline, for example, the telephone assistance program. A lot of times you can just have proof of food assistance or energy assistance enrollment and get that. But I think for a lot of these, unfortunately, you will have to do some paperwork.
Okay. I know My Soap has tried to look at how they can, enter the information one time and pre-populate various applications to avoid, so you can spend more time with the client and not redoing the application.
Right. And I know several states are trying that, and hopefully they'll make progress on that soon. But
it's probably easier to do it at the state level than at the federal level, for sure.
Absolutely. Yeah.
Thank you.
Yeah. Mm-hmm. Okay, let me move on to just a few other resources I wanted to highlight, and then we'll have time for additional questions if folks have it. So we, as I mentioned at the start of this training, I'm with the Center for Benefits Access at NCOA, and we are primarily create tools for professionals. We have a separate part of the NCOA website, which is geared specifically for older adults. But within the Center for Benefits Access, we really try to equip professionals with tools that they need to work with clients. So we've got a lot of program fact sheets on the core benefits, the core eligibility criteria. We usually every year release a chart for eligibility and coverage for the Medicare savings programs, for the extra help program. We do have some sample outreach materials and tools that you can download and tailor. We have some promising practices in benefits outreach and enrollment. And we also have some mapping tools that help you see kind of where there are people who are enrolled in certain programs, where there are pockets of people who are not enrolled in some of these programs, that some people are able to use to do targeted outreach in certain communities. So you can see the web address there, and I have sent these slides in, and you will receive a copy after this presentation, so you don't have to jot all the links down. Some of these resources that I'll just sort of highlight as there's a core benefits cheat sheet, which is just basically SSI, LIHEAP, food assistance, extra help, Medicare savings, just kind of a basic eligibility criteria, numbers, who administers it, and how the person gets the benefit. We update that every year once the new poverty guidelines have been released. We also have a series of Benefits 101 training slides, which you're able to download, tailor for your staff or counselors. Again, kind of a very basic, what are these benefits? How do they work for older adults? As I mentioned, we have this Medicare savings program eligibility and coverage chart, as well as one on extra help, again, updated each year once the federal poverty guidelines have been re-released. We do have a newsletter for professionals, and it's once a month that it comes out. And if you'd like to receive that, if you go onto NCOA.org, scroll to the bottom of any page and you'll see this Let's Keep in Touch, and then you can sign up for that or any other newsletter. You'll see kind of information about the types of different newsletters we have that you're welcome to receive, and we don't sell your information or anything like that. It's just to receive mail from us. So Emily pointed out when she did the screening of this toll-free number that we have on Benefits Checkup, we have partnered with GreenPath Financial Wellness, which I'm sure quite a few of you may be familiar with because they are headquartered in Michigan. They are a nonprofit call center that they help people with debt counseling, credit counseling, reverse mortgage counseling, and now some benefits counseling. We have partnered with them to basically run our kind of call center related to Benefits Checkup. So they are available 9 to 5 Eastern Time, Monday through Friday, both in English and Spanish. They can answer questions about the tool. They can guide people through the screening and produce reports and send the reports to them if necessarily. And then they can also provide kind of referrals, community referrals to people who need other resources that aren't necessarily benefits related. So anybody who calls, they'll determine what it is you're looking for, provide an information and referral if you're not looking for a benefit, or offer to conduct a screening for somebody if they are looking for that service. So I wanted to point out a brand new resource that NCOA is working on that is coming this fall to Michigan. And this is called My Care, My Choice. So for many years, the administration and CMS, which is the Centers for Medicare and Medicaid Services, have really been promoting this concept of integrated care for people with Medicare and Medicaid. So when somebody has both Medicare and Medicaid, they can choose to have separate health insurance, but that often means that they need to go out on their own. They need to find a provider that accepts both Medicare and Medicaid payment. Their providers don't necessarily talk to each other. And there are, all sorts of pitfalls in terms of navigating care. So a number of years ago, the Centers for Medicare and Medicaid Services invited states to work with health plans to create what they call integrated care plans. And integrated care plans are plans for people with Medicare and Medicaid that are kind of full service. So, they coordinate the payments, they offer the range of services both covered by Medicare and Medicaid. And it's another choice that people have in the market when they're looking for coverage. Now, it's not necessarily the best choice for everybody because often they come with networks of providers, and somebody may have a provider, a dermatologist who's not in the network, and their integrated care plan doesn't cover that. So that's a pitfall. A number of years ago, the SCAN Foundation, which is a group out of California, had created this decision support tool to help people with Medicare and Medicaid to figure out what options work best for their situation. Our funders at the Administration for Community Living really liked this tool, and they asked NCOA to expand it into other states. So last year, we launched it in Ohio, and later this year, in time for Medicare open enrollment, we're going to be launching it in Michigan. And basically, the way this tool works, it's online. It's a very, very short questionnaire, 7 or 8 questions about kind of how people prefer to receive their care, whether they're needing a level of care like that they would get in a nursing home, transportation, other kind of wraparound services that they need. And then it provides just these options may be best for your situation. It's not an enrollment tool. It's literally supposed to be a comparison of what options may work best. So for somebody who needs kind of like adult day services and transportation and other wraparound services, it may say, the PACE program is going to work best for your situation. For people who want the maximum flexibility and don't necessarily need all those bells and whistles, it may come and say, hey, you might want to just stay in original Medicare or a Medicare Advantage plan, keep your Medicaid separate, or you may want to look into this My Choice waiver. So it's going to kind of just provide feedback and information on all the options available. We are working with a group of stakeholders in Michigan, so including people who have both Medicare and Medicaid, representatives from the state Medicaid office, representatives from the MAP program, to help us build out this tool and the questionnaire, and also a comparison chart of the integrated care options. And prior to it going live, we're going to be looking for people to test it and provide feedback. So if you're interested in helping us with that, I would certainly love to hear from you, and we could send you the test website when it's ready a little bit later this summer. But just wanted to flag that because that is coming down the pike this year. Yes, and I saw that comment about from Lydia about other languages. One thing that we heard when we're developing My Care, My Choice is the need for Arabic. So My Care, My Choice right now in California, it's in 4 languages. In Ohio, it's in 2 languages. It will probably still be English and Spanish for the whole website, but for some of the tools, there will be multiple languages, including Arabic in Michigan, because we recognize that you have a diverse population with sort of multiple language needs, and we want to accommodate that. So with that, my contact information and Emily's contact information is here, but we certainly welcome, we have plenty of time for questions if people have additional questions, and we'd be happy to re-demonstrate anything that you may have missed from benefits checkup. It's a quiet bunch.
Yeah, please feel free to come off of mute and ask your question. We do have time as stated. Thanks, Lydia.
Thank you, Lydia.
Good afternoon or good morning, everyone. This is Octavia. I just wanted to say, I don't have a question, but I just wanted to give a comment. That was a great presentation on both parts. And I have learned so much from listening at your presentation. And I am definitely looking forward to some of these items coming to the state of Michigan, where we are definitely in need of all of these services. I do understand when people was asking about multiple ways, you know, other ways that you can get the information besides just doing it separate. But my thing is, if you can do it separate and get it done, it's still great. So I just wanted to commend you on all the information. It was awesome. Thank you very much.
Well, thank you, Octavia. We appreciate it. And this session is being recorded. I know we put a lot out there, so I'm sure Christy and her team will be circulating the recording as well. So if anybody missed anything, feel free to tap into that, and you'll also get the slides afterwards as well.
You guys will get the slides with your evaluation that we want you to complete, along with a link for the presentation. And then we'll also have the presentation. It'll be stored on our YouTube page with some other videos, educational pieces as well. So absolutely. Thank you, everyone. It's chiming in. Pace appreciates you. I love it. We appreciate Pace.
Yes, we do.
Thank you.
All right. Okay, I'm going to just share one more slide if that's okay with you all. Hopefully I can get this to come through. So once again, if you have any questions, please feel free to jump in. But I want to remind everyone, we have a month full of events. And so our next session is next Wednesday, when we will have that decision point, some more conversations around Medicare versus Medicare Advantage. And then on April 20th, which is not here, that is our huge Money Smart event. You guys hopefully have been seeing that information posted everywhere. We have a number of speakers coming through that day. And then on April 27th, then on April 27th, we have our How to Access Food Programs and Benefits. So this month, we're really focusing on using technology and how to increase our benefits through using technology. So just remember, thank you, everyone. Thank you, NCOA. Thank you, Brandy. Thank you, Emily. This was so, it was really, it was beyond informative. I don't think you know how informative it was. It was really, really good. And so we welcome you to come back whenever you have more information. We once again thank you. Ann, I didn't know if Ann Holmes Davis, are you still here? Did you want to take us on out?
Yes, I have the same sentiments. We are absolutely thrilled that both of you could join us today to impart the information about benefits and services and how you can look at this holistically. Thank you so much for being available.
Yes, thank you, everyone.
Thank you for the opportunity.
Oh, thank you. You are so welcome. So remember, you guys will receive your evaluation along with, it's just a quick survey about today's workshop, in addition to the worksheet, the workshop slides, and the link to the presentation. So thank you, everyone, on making sure there's nothing else in the chat. Thank you, everyone, again, and have a great day. And we will see you next Wednesday. Same time, same place, same link. We will see you next week. Thank you so much, everyone.
Thank you.
Thank you.
Bye-bye.
Bye.